I was tired and I didn't feel well, and I just wanted to feel better. I was probably late 50s, and I could tell, that things weren't normal because I was having bleeding every couple of weeks.
I noticed that my mom she started feeling really tired, and over time just really started withdrawing herself from family activities, social functions, just not really being herself.
I had been having a lot of bleeding. I had a lot of blood clots. It was very heavy flow, and I was so uncomfortable, and I was getting very tired. And at one point, before I had been referred to Dr. Vignali, I had passed out from my condition, and I was also anemic. So I went to Dr. Vignali, and he did all his preliminary testing and everything he needed to do. And he told me that I would probably need to have a hysterectomy, but there were other options that I could pick.
I, for example, don't use surgery as a first step, because there always have to be the less invasive options that will be better for the patient.
He just basically let her know you can let things go, which isn't really an option. You've been there and done that, and that's not really working. Or you can do something that's longer lasting and permanent. And for me, for her, that's what I wanted. But when we left there and talked about it, she was happy to finally have an answer to her issues. They were years ongoing.
We like our patients to be involved in their decisions, and we at that point decided that robotic surgery was one of the best options for her because the advantages that robotic surgery can give to the patient, so compared with other type of surgeries.
I had never experienced robotic surgery before, and I didn't know anyone who had done it before. So it was a new experience. I went in on a Tuesday morning at 5:30. My surgery was at 7:30 in the morning, and I was back up to the room that afternoon by the time I went through recovery and everything, and then I went home the next day.
If Marsha have a traditional surgery, the option that I see will happen will be an open hysterectomy, which will put her on a 6 to 8 weeks recovery time instead of 2 weeks recovery time. It will increase as much as 10 times her pain probably from the surgery. And as well, the risk of complications after you do an open hysterectomy will be higher than compared with a robotic surgery.
Her condition the day after was amazing to me. She was in and out of bed. She was walking around. I had went to help her, and I was like, you don't really need my help. You're good to go. And it was phenomenal. It was so short. I was amazed about her recovery.
I mean, just to be able to go home the next day was amazing to me, because I had seen other ladies who had had the normal hysterectomy, and their recovery time was months. And I was driving in 10 days.
The point of this kind of surgeries, again, is the faster recovery of the patient, the minimum pain so that they have after, and that allows them to recover as well. There is less blood loss during the surgeries, and it's, the dynamic of the robotic surgery is It's a little bit different than the regular straight stick laparoscopic, but I think is the improvement of the technology is helping the patients and helping the surgeons as well to perform better procedures.
I would love to thank Dr. Vignali's office for taking such great care of my mom and continuing to take care of her and be on top of her health care.
Before my surgery, I was so tired and sick. I couldn't attend any of my grandson's sporting events. Now I go to cross country, swimming, baseball. I just go to everything.
It's been great having my mom back. She's my best friend. We're very close. And to have her be absent from a lot of our family activities, especially with her grandsons, it was like a piece of our family was missing. So to have her back and involved, it's been wonderful.